96.7 FM Radio Iligan.
Lagi ka pinapakinggan kahit saan, kailanman. My favorite music radio. Ang pinaka-maaasahan kahit saan, kailanman. My favorite FM radio.
Ang inyong madunggan nga programa iya lamang sa nagdumala ni ining maong tulumanon og dili minugna sa FM radio station. Alang sa mga ginikanan nga adunay anak nga nag-edad 18 anyos paubos. This program is rated SPG. Please be guided accordingly.
Welcome to Healthy Friends. Get ready for healthy living, where we share tips and stories for a healthier, happier you. Stay tuned for wellness insights and expert advice with Doc Cat, only here on 96.7
FM Radio. Favorite Music Radio. FM Radio.
Good morning mga Iliganos, good morning mga ka-healthy friends. And again, isa na namang Tuesday hatod sa inyo ng Friends Radio o ng Iligan Medical Society na para makatabang no by giving health information na yun nga sa ating ikabuhi. Let's all live healthily. And today, we consider this as an emergency na panawagan sa tanan itong topic na to because we are once again talking about HIV AIDS. No, bakit urgent? Kasi tumataas. Sabi nga natin, tumataas ang bilang pero ang edad pababa. No, so yun ang urgent sa atin. I think hindi siguro mga ang dapat kausap namin siguro this morning is mga parents, because we're talking about exposure ng mga bata para ma-detect later on, how many years later, na meron pala silang HIV AIDS. And we have today, our Suki, infectious disease specialist. I'm sure kayo tanan mga Iligano nung nagka-COVID mo. Unsa may mga pneumonia dyan, nakaagi mo sa care ni Dr. Lionel Quitos. Hi, Doc Kits.
Hello, good morning. Nanaputa diri.
Of course, yung panahong yun, wala mo yung choice. Muagi mo kay Doc Quitos. Kasi COVID yun. Yes. And also, new to our show and hopefully his first and hopefully not his last, si Sir Dwight Morales, our psychometrician. Hi, Sir Dwight.
Hello, ma'am. Hello, Doc. Talong Doc's pala. Good morning.
So, sabi ko nga, si Dwight, na-encounter ko because we talked in one of the barangays here na sponsored ng SK. So, of course, ako sa kidney health. And it struck me yung kanyang confidence sa crowd, Kasi anad siya sa mag-interact sa mga batanon,
Yes,
so basically ang pinaka-specialty mo is yun nga sa mga youth.
Yes, usually the youth po.
Sa youth. Okay. So sige, why do we need Sir Dwight here? Kasi gusto nga namin kayong kausapin, then mga bata to. And feeling ko dahil sa kadugayan na tong AIDS na to, itong HIV na to, tapos karon pabata pa, baka need na natin ng tabang na someone na kabalo kung paano kumausap sa mga ganitong age group and how to baka iba na yung generation natin, naglahi na baka lahi na yung aming way, kaya hindi namin ma-penetrate. So, sige, Doc Quitos, I know na we've talked about this before, pero sige nga, give us an update. Why is this an urgent topic karon?
Okay, so good morning again sa tanan. So, ang HIV AIDS, let's talk about it first, na isa ni siya kasakit nga plainly speaking, magpatay siya sa imuhang mga sundalo sa lawas. Ipa-weaken niya imong immune system to the point na katong mga kagaw dili dapat maghimo og sakit sa tuwa, makasulod sa tong lawas ug magsugod siya og sakit. Then mo na kamatyan sa pasyente kanang ato ang mga tawag na opportunistic infections, So mo nang hadlok kani siya nga sakit. Kay so far wala pa gyud tay tambal nga mopatay sa kagaw. Kaya ato ang mga tambal karon igo ra nila patulugon ang kagaw. So mo nang and also another thing nga mahadlok ta kay grabe ang iyahang pag-spread karon. Sa Pilipinas, maybe nakadugmo ani sa news, no, nga 550% ang iyahang increase compared
Grabe,
to
no?
2010.
Oo.
Okay, so yung na nakapaspas, no, in just 15 years, ning sakat ta og 550% ang ato ang number of HIV patients kana kato pa na mga diagnosed. Wala pa na-appeal to mga not diagnosed kay wala pa nagpa-screen, no, wala pa sila kabalo nga naa sila sakit. And so for the pinaka-recent nga data, ning gawas na manggod ang data sa DOH for the first quarter sa ato ang HIV update. This year, first quarter, compared to last year, this year, naatay 57 new cases every day.
Oh my God.
Every day, once a day, 57 cases.
Oo.
Murag, mahulog siya nga, yan nakadaghan yun, murag makahadlok. As compared to last year, 37 lang per day.
Actually, yung 37, mataas na yan,
Taas
no?
na siya kayo. Kay,
Oo.
nato mga before, when I was on training, mga tag 20 plus
Oo.
lang. Then, pag tungtong 30s na, kulbaan na mitanan, karon 57 every day ang ato ang new cases. So, yan nakahadlok diri sa Pilipinas. So, dayon, what's more alarming is na-mention ni mo, Doc, nga ang iyahang age group nga affected. Kay, mga around 33% or one-third sa mga new cases this first quarter, nasa age 15 to 24.
Oh my gosh.
One-third of the cases.
Very concerning.
50% of the mga 47 or around half of the cases naa sa 25 to 34. So batan-on ang mga naigo ani nga mga kani nga sakit. So and what's concerning also is kani siya wala nila nakuha ani nga day. Ana nga time na diagnose sila. Nakuha nila na ang sakit years way before pa na. So katong sa 15 to 24, siguro nakuha nila na mga around 5 years ago, 8 years ago. So kung naatay 15, nakuha niya 5 years ago, but pasabot 10 years old siya, nakuha na niya ang sakit. So I think mo nang very urgent na atong istoryahan karon og how do we approach this problem. Dili lang kay magsigiyo tag-ihap. We need to do something within ourselves, no? Dili man ta pirmi magsalig ta sa gobyerno nga sala sa tanan sa gobyerno sila dapat mahimo sa programa. Dili, let's start within our family, within our household nga dapat natay buhaton, educate nato ato ang mga anak nga dili sila mo engage in ani mga risky nga mga behavior. So munang ko update for now. Then murag sad kay siya nga update kay hadlok.
Parang 57, makaabot niyan to the point na parang each community na ano mo'y kaila na naa, no? Technically. Of course, kasi yung common way of transmission kasi of AIDS, HIV, is a very private matter, no? It's, kasi yung mode of ano niya is very private. Kaya walay mo musulti na naa siya. But technically, the census is saying na nandyan sa community natin, no? Pailan-ilan, baka na talaga. And meron bang nasabi ba dun sa census, what sector usually ang na-detect? Like, aside sa age?
Aside sa age, region. Sa region, mostly NCR yun.
Okay.
NCR, Region 4. So, ang sa Iligan, which is part tas Region 10, ako yun ihap gagabiin, no? Kung kita dapit, we rank number 9.
Oh.
Okay.
No, sa overall sa kadaghan sa murag nata sa tunga-tunga of the 18 regions nata sa number 9.
Oh no.
Okay.
Okay, so medyo
Actually, bumaba tayo. May time na medyo nag-top notcher tayo.
Medyo time na then karon nata sa number 9. Ang problem with that is kana ra siya katong mga diagnosed lang.
Oo.
Daghan man po dili wala pa nagpa-test. So we don't really know the real numbers, no? Kani siya murag estimate lang ni siya siguro nga unsa kadaghan per region. Ingon ana, no? And then another way of looking at it is by gender.
Okay.
Gender, most of the time it's among MSM or male having sex with male. No? Naapod uban nga tawag nila silang selves bisexual. Mupatol sila sa lalaki, mupatol sila sa babae. Nga male nga mupatol sa lalaki, ug male nga mupatol sa babae. No, bisexual male. Kana most of the time kana. Pero pwede gyud gihapon siya sa mga babae, no, especially those nga naa sa sexual na kalakalan. Okay? And sadly napoy bata na less than 1 year old, no? I mean, pagpanganak sa mama, undetected nga positive di ay ang mama. Pagpanganak niya, natakdan niya ang iyahang anak. So naaputaan na.
So yun, so narinig natin ang ating updates, no, on HIV. And how are we faring if we're going to compare ang whole wide world?
Ay, top-notch ang Philippines. Yeah, UN, WHO, UNAIDS and WHO, they're really concerned sa Pilipinas because of our growth sa ato ang number of HIV. No, kay daghan gid kaayo diri sa Pilipinas. In other countries it's being controlled naman. Sa ato it's aside from the growth of the number of patients or individuals infected, gamay ra kayo ani nga mga tao ang nagpatambal. Gamay ra pud kayo ani nga mga tao ang virally suppressed. But pasabot pag test silang dugo, dili na ma-detect ang virus. No, tulog na ang virus ilahang lawas. So the UNAIDS and WHO na sila kaning 95 nga protocol. 95.
Yun yung goal dapat.
Yes, yung goal is 95% of the infected dapat ma-test. And 95% of those tested dapat nagtambal na. And 95% of those nga nagtambal dapat virally suppressed.
Wala nang detected na
Undetectable
virus
na.
sa dugo.
So muna ilang 95. Sa Pilipinas, ako yun ang gikuha, no, dili lang ko ma-memorize. Sad kayo ato kay only 55% ang ato ang na-test.
Okay.
And so among the 55, only 66% ang gatambal.
Okay.
And among those 66%, only 40% ang virally suppressed. So kung nataskulahan, bagsak ta.
Bagsak tas on all parameters.
On all parameters, wala yung UI sa maestra. Bagsak kita. No, so munang concerned kaayo ang global community sa Philippines because of our uncontrolled HIV na situation. Mo bitaw to si President Marcos, yahang gipa-declare sa DOH na first priority ang pag-control sa HIV.
Tapos kasi nakita ko din yan post ng isang bantog na infectious disease specialist. Yung next sa'yo na bantog.
Next sa akin. Ako nagturo sa kanya.
Isang bantog na infectious disease specialist dito sa Pilipinas, pinakita niya, although you can't help it, yung prevalence, meaning yung total cases ng mundo, hinay-hinay, minsan musaka or mo stable. Pero yung incidence, paubos na ang buong world halos. Tapos bigla ito si Pilipinas, makita mo ang graph niya
Taas ng taas.
paakyat. Kaya na parang ano bang nangyayari sa atin, no? So Dwight, ayan yung isa naming kasing malaking question mark. Alam mo, this AIDS advocacy has been going on ever since. Even yung mga una nating napanood, 'di ba? May mga yung movie ng mga unang AIDS, 'di ba? Yes. Sila Vilma Santos, no, yung mga movie nila, yung mga namatay yung true to life story, mga kusog na kaayo. But it seems like there is something weird with how we're communicating, and baka it has something to do with the type of generation that we are handling karon. So asa na nga ba tayo sa generation letters natin?
I believe sa Gen Z na po tayo.
Millennials?
Mga millennials, Gen Z.
Ang dili pa alpha.
Ay, hindi pa. Pero patungo tayo dun sa Generation Alpha.
Okay.
Okay. So, millennials.
Mga Gorsta.
Mga Gorsta. Ikaw, ano ka na?
I think nabilong ako sa Gen Z na part.
Wow.
I think. Hindi pa sure.
Bakit nga ba napunta ka dito sa sa advocacy mo with youth mental health, and what parang magnetized you towards it?
Usually kasi po, the youth is the one na when according to Eric Erickson, it's the starting point of finding your identity kasi. And when we're trying to find identity, there are tendencies na we try to find it the wrong places. And we have tendencies na if we're going to have a throwback kasi when in our teens nga, di ba? We have the tendency to remember some bad memories that we did some risky na mga behavior siguro, but not to the point of HIV naman. But siguro that type of behavior na you really want to try things, okay? You will really want to try something new. So those are some of the things that we have to take note, and especially at this generation kasi especially social media and the internet is very strong. The youth is already very exposed with contents. It will also include explicit content, I will be honest. And also, what magnetized me to the youth is that I've done some mistakes at the past, and I really want to contribute to the youth to be able to help them siguro at their career path, in their choices, perhaps. Siguro also when it comes to their mental health. It's because ngayon laganap na yung mga heights of increasing na yung risk of depression, yung suicidal ideation, very mataas na rin compared with the last generation. It's because the youth is trying to seek their identity on siguro the wrong places again. There are tendencies nga naman, they put their self-worth on siguro social media. Kapag siguro if I have high followers, maybe people see my value na siguro I guess I'm important because people follow me, they follow my content. Kapag wala akong followers, hindi siguro nakikita, worthless siguro ako.
Walang thumbs up or heart.
Walang thumbs up or heart. So the tendencies kasi, there are tendencies kasi na the youth are now this is the peculiarities of the youth kasi. Ngayon, it's because they seek their self-worth based on the numbers of likes, the numbers of followers that they have.
Ako, I can get a cut-off Talagang itong social media na to, nag-start sa akin 2010. Makikita mo na sa Facebook, di ba? Friends since 2010, 2009. And I think, that alone really created bigla a boundary. Yung mga nabuhay nung mga panahon ngayon. 2009, 2010 minus 2025. Yeah, you're dealing with the youth na nakasulod dun sa
age group.
Dun sa margin, yung line that was created before 2010, before the boom of this to ngayon. Friendster.
MySpace.
Yeah.
Friendster. May akong friend, naabutan mo ba yun?
Naabutan ko yun, pero wala pa akong account.
Yung mga Friendster.
So yung sa Yahoo, di ba?
And yun siguro isang driver. Social media has really placed a big role.
Yes po.
Also both on how to rear this present youth and also how yun nga, yung mga influence that they can
and
that
also
they can get.
access.
They have great access with social media.
Because ako'y patient before, when I was training in PGH. But to cut the story short, naabot siya sa MUA because of DSWD. He was 19 years old that time. Kay gi-rape siya and all. Gipa-test siya for HIV. But unfortunately, positive siya. So kato nag-rape siya patong natakdan.
Ala.
Okay?
So, natakdan niya ang nag-rape sa iya.
Kay positive man siya during the rape. When we did counseling, as early as 12 years old, ga-chat na siya sa Facebook Messenger. If na siya makita nga picture nga by the way, this is a homosexual male. Kung makita siya picture nga ganahan siya nga lalaki, the feeling niya nga mo interact with him. So chat niya and then flirt and let's meet. And mag-meet sila and then they do it. And then humana. So ingon ana ka accessible sa ato ang young generation. Ang to engage with other people. Through just by chatting. And I found out also na naapre other nga mga platform aside from Facebook, TikTok, Instagram. There's this Grindr, Tinder, alam ko sa mga uban names. Other nga mga platforms that they can have easy access on, tawag nila hookups. Okay?
Doc Kitos is married, okay?
Sorry.
Important to know.
Important dyan kasi mga Tinder.
Oo, no? So, pumoto nga, I was really shocked na hindi, dapat makita yun siya. Na name, and this name is, dili siya, if ikaw parent, dili ni mo ma-check nga, mo din ni siya ang, this is a platform day for that.
For dating sites po.
Dating
Doc.
site day siya.
Yeah.
The name of the platform is, wait. Ano ni siya this is from a journal from the Philippines.
Oo.
Lasa Lista. Ang nag-publish ani.
Okay.
Ingon siya.
Na parang-
The name is Tinder, Bumble,
Bumble.
Grindr, Filipino Cupid,
Mm.
OK Cupid, Coffee Meets Bagal.
Very subtle talaga yung
Coffee
name
Meets
nila.
Bagal. So kung ikaw parent basin hilig lang ni og coffee,
Oo.
dinig bagel ako ang anak.
Mukhang ang game nga rin siya.
So it's really alarming daw nga ma-hide nila by their name ang ilahang intent.
Kaya yan. And also, they meet up, no?
Yeah, they meet
They
up.
meet up, Jude. Buti sana ko sa chat lang.
Yeah.
Yun sana yung safest for us with HIV/AIDS.
Oo.
Chat lang mo.
Oo.
But they meet up. And of course, it's not like before you meet up with someone, mangita ka ng kanyang screening.
Oo, yeah.
Ng kanyang screening
Yeah.
test, no? So, yun, no? Marami na rin kasi ngayon, like what Doc Kito said, the census is leaning towards mga MSM, no? Based on your encounters also, no, with the youth today, marami na rin bang mga nag-open talaga? Marami na, no? Compared, of course, sa generation namin.
Yes po.
Before, maghuhulaan ka pa kung sino yan,
Yes.
no? Tapos ano usually ang nakikita mong dahilan why they change their gender preferences?
Okay, so for that po, I think we should go back on a bigger picture po. Kasi I think it stems back on the American culture. Yung kung anong sikat nun sa US, it's going to be copied by the Philippines. I think it's getting normal din dito. And usually, that's number one. And number two po is that we're now exposed with contents. We're now open with such content such as very explicit contents na we didn't even know na it has those specific contents, sexually rin, to be specific. And it's because of probably those two. And since we're now open with such contents, I guess the youth are now influenced na, it's okay lang pala to. It's very normal. Since it's normal naman para sa US, so we're going to do this also. Yeah, eksakto rin yung giingon ni Doc nga katong sa hookup culture, no? So that's specifically, that American culture has become normal, especially sa mga sa youth, because since what they see at Netflix, maybe this is normal since it's okay siguro to do. It's because the Americans do it, so why not we can do it as well. So, and since they find siguro the type of kanang pleasing sensation bitaw nga they find satisfaction ani, and then to the point that they put relationships like no label relationships, and then wala nang anong type nun, wala nang exact na worth yung relationships. Because they find pleasure nito, so they don't find any siguro worth on relationships. So that's why siguro ngayon because of the internet, many factors are now affecting the youth kasi it's because of these such influences, the American culture, Netflix, and even the dating apps. And because of those dating apps, it's dali ra gyud kayo makakita og people that feel mo na this person can satisfy me, or this person, I love this person siguro, I find this person attractive. Immediate kasi we really want things na immediate, like yung sa yes.
Yun actually yung ginawa ng social media sa atin, because you can get everything in a click. Kaya
Yes.
even your mind is wired na napaka-impatient mo, no? Hindi, wala na yung noon na yung internet. Dial up ng tagal-tagal. But yung mga ganun, yung mga subtle changes lang sa technology, like how we make things faster, no? It also creates this wiring in our brain na even yung mga pleasures natin should be satisfied within within a
Yes. In one click only.
in a click. And like what you said, kasi isa nga sa isa naman sa advice for HIV prevention, 'di ba, is monogamy.
Yes.
And what you said na yun nga, parang relationships are almost non-existent, 'di ba?
Yes.
Then they can just go from one pleasure to another and to
Yes.
another, then that could be also a risk factor for this
To be more
for
exposed.
this generation.
Yes.
Parang yun siguro parang wala kang patience na tumagal sa isang tao. No, you need to go from one to
One person to another
one
naman.
person
Yes.
to another. So pag may mga lumalapit sa iyo, ano yung usual struggles nila? Yung mga youth that you counsel, ano mga na-encounter mong usual struggles nila?
Usually po, their usual struggle, since I'm affiliated with LaSalle Academy, so the usual struggle that they encounter is that siguro more on the academic side yun.
Okay.
Kasi they get stressed kasi maliit na siguro yung grado nila, and then there are also siguro small lang naman na problem, like for example they have a family problem, and that's the thing, it should really start with the families, especially with the youth today. I really encourage parents to always siguro nagkulang rin yung parents sa pag-monitor ng mga bata, no? So that's why we from the guidance kasi we just try to help our students as best as we can, but also it should be two ways kasi, the guidance and also the parents. Parents should also be the one to primarily have to give the emotional support na needed sa mga bata. Kasi this will strengthen their identity. Kung sino sila as a person, they will gain confidence starting from their families. And we from the guidance, we just help students cope up with their mga struggles academically. And at the same time, siguro yung mga personal struggles nila na we really don't know. But normally, what we encounter is academic stress. There are also times na relationship rin, problema rin nila. And then, yung meron rin pala sa family.
Okay. So do you think these stresses can also lead to these risky behaviors that we are considering karon as contributory to an increase in HIV/AIDS in the younger age group?
I think so, since I think having lackness of family support is number one. It might significantly tell us that siguro that's why they do risky behavior, because they do not have the proper guidance starting from their families. Number two, they also try to find siguro affirmations from their friends na okay lang ba ito, okay lang bang ganyan. And if they do not also if they're not being careful, they might go into bad influences, bad friends na makapag-lead to them to do risky behaviors. And then number three, siguro it's possible na yung depende rin yun sa mga contents na they feed to themselves, na they are wired to look at. Okay, so these contents can also significantly increase the risky behavior. So probably these, I think so far these are the three factors that I can see.
Yung mental health issue kasi ngayon is talagang mas mataas mas mataas. I mean, even kami nga sa adults, bigla, di ba? For those in the workplaces, meron ng mga mental health leave.
Yeah. So I think it's more on awareness, no? We are more aware nga. Dili day ni siya inarte lang, no? So una kay inunlantaan nag-inarte ra ka ana. So ako day nga ay it really exists. Kani akong gi-feel karon, it's valid pala, dili siya kailangan i-brush off. So most siguro nga we are more aware of these mental illnesses, no? And mas ma-apply na nato ang mga or mas ma-express na nato nga valid na day ni ako ang gibati di ay, no? Dili ta ma-shutdown dayon ba?
At saka buti yun nga, active yung guidance, no? Yung guidance office sa inyo.
Yes po.
Dahil at least, kung hindi man nila nakukuha masyado sa household, at least, they have someone to,
They can
they
go
have
to.
someone to go to. Actually, yung field of medicine is, evolving pa with regards how to communicate with all these pronouns. Medyo taas-taas, no? Ako, na-overwhelm ko. I sat down in one of the convention topics namin na parang hindi ko maka-take down nun sa kadaghan. Daghan eh,
Yung mga
daghan.
pronouns.
Kasi tinatry naman talaga din eh. Tinatry din i-recognize. Again, the high risk is the MSM group or those na who caters to multiple partners, different genders, no? And yun, we're trying to really name people exactly as how they should be based sa kanilang preference. Ang dami. Parang before pangalan, gender FM. Ngayon
Yes.
actually yung mga forms daw for gender sensitive clinics medyo taas-taas, no? Hindi lang siya yung the biologic, meron pang sub within the biologic genders. Do you think ikaw important din that these are recognized for them to hear us out?
For me po, I think yung mga pronouns, for me it's not that much
Ang
important.
culture ba natin dito pala medyo sensitive with pronouns?
I think
na-
we're in this culture right now very sensitive, and I think we do not give much value when it comes to pronouns kasi. And I think those pronouns usually po yung anong tawag nito? Yung approach ko kasi when I address to them, I just state their name, just directly sa name nila kasi they might find it offensive if I were go to siguro if I use the wrong pronoun kasi. So I just go directly to their birth name and then just talk to them and then directly look at the problem kung saan ba talaga yung problem, okay? So usually po I think again we're still Philippines in general is a very conservative na country, and we are yet to open up with that idea na with the pronouns. Kasi again, this is part of the American influence, yung American culture of pronouns.
Sila naman nagturo sa atin ng pronouns.
Oo nga.
Sila din naman. So ngayon nire-revise na ulit. Pero I think this is something na we need to accept as present in the community, di ba? And somehow we need to evolve also in learning. Kasi yun din yung isang naiisip kong barrier eh. Baka kaya hindi natin sila makausap di tayo come across masyado sa kanila. Baka they feel unheard ba, no? Oo, ikaw, yung mga students mo ba who are like in the brink of identifying themselves, what are their usual struggles?
Usually po, normally, they really have struggles. They have trauma from their families. Imagine from the families themselves, they have trauma. And it's because since they lack the family support that they needed, the emotional support also, they seek it on different places, especially their friends. Depende yun sa mga circle of friends nyo eh. And then if you belong to the community that gives value to those pronouns and identity, they will try to form their identity with those pronouns, and their self-worth is now stuck with the pronouns themselves. So that's why I think it really stems back with the families. So basically, again, I think it should be noted that parents should be the ones to give support to their children, and at the same time, if possible, they have to learn yung makisabay sa uso siguro if possible. Because I don't think lahat ng parents they can catch up with the trends kasi.
Ikaw, kailangan mo as an infectious disease specialist. Ako kasi left and right kidney lang naman ako dahil nephrologist ako.
That's why when nasa clinic ako and when I cater to HIV patients, so not just HIV patients, also other mga patients, may mo po kong gamay counselor, no? And I talk to them what stresses you. Kay, like for example, HIV patients, no? We know nagka-HIV sila because of their risky behavior. So sometimes I dig, no nga, what made you engage sa yung aning activities. It's not just enough to treat them, but we also need to understand why naka-encounter sila, why they engage, no? So that para in the future, I know how to approach the patient. Kay dapat mag-stop man siya sa risky behavior or else mag-continue ang pag-spread. No? So muna nga I talk to them, can I good stress, no? And sometimes comes within the household ang ilang stress or even within themselves. That's why dagan kay ko gina-refer kay Dr. Dasida for even sabi mayon ko nga I think you need professional help.
Mm.
No, so morning number sa secretary ni Dr. Dasida, sa
Psychiatrist.
and you may talk to her, or if needed kailangan kag medications. Kay again, for me mental health is very important. No, dili na siya kailangan i-brush off lang siya nga issue, because it's real. It's happening. We don't need to invalidate kung sila mga na-feel. Kay
True.
kung ato invalidate, they would act out o muna nga ma-promiscuous sila, because sometimes they're needing affection from other people na dili nila makuha silang family. No, so munang sakto yun lagi psych yun ako ang second choice ako sa college.
Kasi no yun, I guess you need to spend time a lot of time no, sa ganyan.
Munang dugay ko sa clinic mo human. Munang nag-cut off na gyud ko kung mag-cut off na gyud ta kay mabtan sa gabi magsundo pa ko sa akong anak.
sa
Dugay ko human.
Pero meron akong ganyan meron akong actually we have a young patient na perbati na kaayo yung patient, and we are considering HIV/AIDS, and ito naman, it's a cultural issue naman. You know, our culture here is very diverse you know. And that presents a different struggle. And the partner who is equally young actually asked me, kasi ang dami kong kwento, ang dami kong sinasabi na mga proseso na anggianan. Ang kanyang pangutana sa akin, Dok, kung blood test lang man ang himuon, ba't ganyan kadaghan? Oo, but even the secrecy, kaya sabi ko, tinuod ra. I hope it would get to a point na hindi na kailangan agianan ng tanan. Yung if you want a blood test for HIV, just get it, and hindi mo kailangan maging ashamed about having an HIV test done.
I think there are many reasons, no? First is the confidentiality issue. Kay kabalo na ka, marites yun. Ang Pilipino, pagkatao, marites na siya. No? So, the confidentiality issue. And we know, second is stigma. Kay, mahadlok yun silang mabalan sa ubang tao.
Yes.
No? And then, number 3 is, tawag na to nga PLHIV, or people living with HIV. They're really protected by our law. Muna nga, I think, kanang mga process na kailangan nilagian is also legality issues sa part sa mag-test. Muna nga maagigid sila og counseling, they would undergo other nga mga tests, mga papers, signing and all.
At na yung penalty. Kung ikaw doktor, na-leak mo sa lain, ikaw yung medtech na nagkuha ng blood, na-leak mo sa lain.
Even sa workplace, kung for example na ay mag-leak nga work coworker, or gitangtang ka sa inyong company because nabalaan nila nga you are a PLHIV, pwede sila makasuhan sila tanan. So yan naka-protected ang PLHIV. So that's why walaon sa ato ang mga batanon, no, nga kabalo mo nga ni-engage mo ana nga mga sexual activities, so high risk activities. Walaon ninyo na inyong una-una nga mahadlok ko nga may balaan, or mahadlok ko mas stigmatize ko. So magpa-test yun ta as early as possible if you know na nag-engage ka mga high risk ka mga behavior. So unsa man yung mga high risk behavior? Number 1 is, this is a main route of transmission, is ang sexual activity, unprotected. Kay naay census sa Pilipinas among married couples, only 4% pala ang gagamit og condom. How much more sa mga unmarried, dayon ka mga risky hookups, no? So balabaw kay kato akong mga patients ang gina-cater, when I ask them, almost 100% wala gid sila ga condom. Okay, so kana risky behavior, unprotected sexual intercourse. Next is by injecting
Drugs.
Because of sharing of needles. Because maybe dili aware ang uban ani, especially kamo mga ginikanan nga naminaw karon, naaga kahitabo nga ginatawag nila karon nga group fun. Group fun is their term for orgy. So unsa nang orgy? Magtapok-tapok lang sila. Bisag kinsa lang, tapok-tapok, text sa mga kaila, tapok. And then mag-sexual intercourse sila tanan. Unprotected, and sometimes they do drugs. So kana nga activity dili lang kay gonorrhea or tulo ilang makuha, syphilis, hepatitis B, hepatitis C, pwede kaayo ang HIV. No, so inga na ka risky yun ang ato ang mga kabatanunan and gakahitabo ni sa iligan. I'm not talking about outside iligan.
Naana dyan.
Naana diri sa iligan. Ako mga patients ning disclose sila nga, Doc, yes Doc, kakahitabo na siya. Dili mo ko mangutan na nga, kung saan di imong gibuhat, gitsuon ako sila. Ni-engage ba ka aning group fund?
Oo.
So, yes Doc.
Oh.
So hadlok kayo. So mga parents, hopefully inyo mabantayan gid inyo ang mga anak. Dili man siguro nga inyo silang paggapuson sa balay. Just need to educate them. You just need to love them. Let them feel your love nga palangga di kanak, ayaw pag buhat og bisag unsa kay imong future madaot or mausab gyud ay imong future if ever. Kay telling you honestly, bag-o lang minamatyan og HIV AIDS patient. Isa sunod-sunod nga bulan. And they're in their 20s. No, it's very young. Grabe ang potential, talented. Makita nimo nga bright, but unfortunately they succumb to the infection. So kana sayang kayo, 20s pa lang namatay.
Pero 'di ba, like what you said, it doesn't have to be that way.
Yeah.
Hindi naman na dapat nakakamatay ang HIV karon.
Yes,
Oo.
because we have free testing sa CHO. Kung gusto ka mas discreet, pwede sa Adventist Medical Center na atay testing dito. And then kung if ever man mag-positive ta, we have free treatment gikan sa gobyerno.
Walay gasto.
Walay gasto. Pliti
Oo.
lang.
And again, if ang kahadlukan mo is the confidentiality, you are well protected
By law.
By law. You don't have to tell it to anyone. No one can also force you to disclose your HIV status regardless kung negative ka or positive ka. No one has to even ask that, 'di ba? No one even has to ask that. It's protected by law. Actually, akala ko nga sa una, mandatory mo i-declare para ma-trace ang imong partners para masultihan. Actually, hindi din. Akala ko ganun. For the longest time, until recently, I need to do this ethics lecture and gibasa ko ang HIV law, dili mo talaga mapugos ang anyone. Halimbawa, murag HIV AIDS jud ka, the doctor cannot force you to do the test even if ang reasoning is for the sake of your other sexual partners or ana, dili jud. So ano na lang talaga yan. It's really sarili na lang nating
Yes.
Oo, pero yun nga kasi like sabi ni Doc Kito, sana yung mga youth, if they know, number one, their confidentiality is going to be protected. And number two, they will live an elderly life.
Yes. Okay, based on studies, katong mga PLHIV nga gatambal sila and then found out na undetectable na. Ang major cause of death nila is same sa mga non-infected. So but pasabot nabalik na nato sa normal ang ilahang kinabuhi. So as long as they would take the medicine every day. Okay. Na-update nga naanay gina-develop karon nga injectable nga once a month na lang siya nga tambal.
For those na makalimot.
Yes.
Na,
So but knowing the Philippines, no, lahi man kita tanan unless marites mauna ta. So dugay pa na mabot diri, but it's good to know nga naay mga developments in the treatment of HIV. Hopefully maabot ang cure.
Oo, wala pa'y cure, no?
Wala
Napakalisod niyang kagaw, no?
Yes.
All these years, cure is very elusive with all the research na nagasto. But very hopeful. Para ka na lang nagtambal ng high blood nimo.
Yes.
Diba?
Maintenance lang.
Maintenance ng high blood. I would even say high blood and diabetes is even more deadly than
Yeah.
HIV karon,
Yes.
no?
Yes.
Yeah,
Agree.
Oo, so yun, no? So sana sige, kung meron tayong daghang kaso, sana man lang maabot natin yung 95% tested, 95% ongoing treatment,
yes.
and 95%
Undetectable.
undetectable. And
95.
you can be a family person din, di ba?
Yeah.
Even with that.
Yes, nakuha na ma'am. Katong, again, itong sa PGH, very first patient na ako ng HIV, CD4-1.
Oo.
CD4 is muna itong mga sundalo sa lawas nga mo detect if na infection. So, ang normal ana is dapat mga 900 or 1,000 plus. Yeah, one lang.
So, ibig sabihin, isang bakterya na lang ang kailangan dumapo sa kanya, deads na
para
siya.
mawala na siya, no? So, and nag-treat ko siya ha, and for the time nga nag-spend ako for my training na 2 years sa PGH, before me mo exit, kaya human namin sa mga training, we need to call back among mga patients to endorse them to other doctors. Nisulod siya sa clinic, wala ko kailan niya. Kay first time, butot balat. Pag abot sa clinic mo, nakabarong. Because he's already working sa bank. Kabarong, gwapo na kay siya. Okay na gyud siya tanan, and then ingon siya. He's a homosexual male ha. Ingon siya nga, Doc, I'm planning to build a family. But if Doc nga, kita kog wife, magkaanak mi, matakdan ba nako sila? I told them no, because based on your record, undetectable na ka for several months. No? If padayon lang ka sa mong tambal, pwede ka mag-asawa, dili matagdan imong asawa, pwede mo mag-anak, dili matakdan ng anak. So, nakita na ko nga, ayang aura from sad, ning blow up gid siya, kay there's hope nga pwede ba ko maka-family. So, pwede gyud na may tabo sa tanan as long as inom, treat early, test early, so that we can detect early, so that we can treat early for a better outcome.
Kasi lahi na yung pinag-usapan natin na dyan lang sa time na bati nakakaayo, going na ka, dyan lang ta mag-test. Dili nakaapas ang effect sa mga, dili nakaapas ang tambal, no? So, I would like to go back kay Dwight. Sa tingin mo, what is the best way of communicating from medium to the words that we use, no? What is the best way of communicating to the youth?
I think it should start first with the parents. They should communicate with their kids. They should educate that risky behavior is not the way of life. It's not something that we normally do. So when we also communicate to the youth, okay, personally, I think we should always there are tendencies kasi na what they just need is someone that will listen to them. Normally kasi that's the case sa amin sa guidance, that those kids just need someone that they can lean on, someone that also supports them, at nakita nila na may value pala ako as a person. So when we also address problems to these kids, we should also be careful na siguro to the point that we have to be very thoughtful when it comes to our words, okay? Because the kids today, they're very sensitive with the words kasi na we didn't even know that they are already offended. So it's best na siguro to educate ourselves and then use thoughtful words that we will not be able to siguro discourage them, and maybe to the point na they will seek self-worth from other people, especially avoid it, especially in the wrong places. So it's best na siguro educate ourselves first, and then be mindful of our words and use this information to be able to communicate well with the kids.
Social media also.
Yes.
If we want to make impactful campaigns, no, pero minsan social media pinipili man nila kung dili nila ganahan tanawon. Browse no, siguro we might need your help to spread the word, no, on how to remain safe. Ano pala, religion plays a big role.
I believe religion really plays a big role po. First and foremost kasi they promote na abstination. Abstination, it's best na do not do it at all. Avoid risky behavior, and if you're still not married, it's best na huwag na lang muna. Maybe at the later part, if you're married, why not? You can since monogamy is very much promoted sa religion. And also at the same time, I don't think it's best na to just ibaliwala lang bitaw ang religion. It's because religion also plays a vital role to keep ourselves healthy spiritually and also at the same time mentally. I think religion can also contribute to the point that there are things that there should be boundaries on the things that are the right thing to do and the things that should not be done. Okay, so already I think religion already also tells us something on what are the correct ways on siguro on relationships, on how we should give value to relationships, to families, and even other members of the community.
Anong stance ng mga youth natin ngayon with regards religion?
With religion, I believe siguro for me, there are still youth that believes in the stance of religion, but I think there are also youth that siguro nagpo-promote ng something that's medyo opposite from religion, and it's usually finding their identity. It's more of ako. Okay, so it's ego-centric when we call it ego-centric, more on sa sarili. Ako ang bahala sa aking mga desisyon. Keep your religion away from me. This decision is mine alone.
Kasi yun din ang isang fear ko no. Baka medyo nadadilute na ang ang effect ng religion no. And yun sana, yun din yung isang magandang anchor no. If the religion is there, whatever it is actually, all religions are good, no, are teaching what's good. Kung anchor din sana yun that can protect our children no from these kinds of risk. Sige, since we are dool na sa atong closing, gusto ko nang pabigyan si Doc Kitos ng rundown. Who should get tested?
Okay. Everyone nga ni-engage in unprotected sex. Dili lang kay katong mga youth nato, but also kung nabuntis ka, put pasabot you had unprotected sex. So ideally every every pregnant women kailangan gud sila matest. Okay, so actually I've talked to some of the OB mga friends nga ga mandatory testing ba mo? Naiuban yes, naiuban dili. So again, everyone nga nabuntis dapat magpa-test. Everyone nga nag-engage in unprotected sex magpa-test. Okay? Especially if na may suspicion nga inyong kaning inyong hookups. Hookups, you don't know kung unsay mga exposure sa imuhang ka-hookup prior. Or kanang even if monogamous, no, because I have patients like this monogamous, tapos ang ilahad ay mga partners ang dili monogamous, no. So kana if na ka suspicion imong partner is not faithful to you, then get tested. Again, free atong testing, no, sa CHO. Pwede ta magpa-test kung gusto mo discreet na sa Adventist Medical Center o sa Mindanao Sanitarium. Also magpa-test katong mga mga sharing of needles, no, mga IV drug users nato. Magpa-test pud mo. Testing doesn't have to be na kailangan kang maadto somewhere because you can order it online.
Talaga.
Nanay online test kits.
Okay.
No, I'm not promoting, but Abbott is a good brand sa mga testing kits. No, so I think they are already disseminating gyud mga testing modalities para accessible lang gyud sa mga tao. Kaya
hindi na yung very lisod baya ang access sa una. Dali nga sabi, daghan mo proseso agianan.
Or mahadlok ka kay makitaan ka dinhi or makitaan ka dinhi. So,
makitaan ka.
Yeah, that's what they do. Food, shades, mask, no? So they made it accessible. Pwede siya online i-order. They can do testing at home.
At si Kuya Ninja Van naman, hindi naman niya abrihan
Hindi
naman
na niya abrihan. Discreet po ang packaging So that's why moto mga person na kailangan magpa-test and mo po itong mga testing nato na ata sa CHO, Adventist Medical Center, and you can order it online.
Okay, so yun, no? And yun nga, if you think na yun, multiple partners, no? You need to... Healthcare workers!
Healthcare workers, yes. Okay. We can also get this infection through needle stick injury, no? So pwede taan na. Or even, naay nahitabo na na-splashan siya sa mata. No, so pag-report sa kuha, diretso din siya o prophylaxis.
Nagano na siya.
Kay kuan
kabalo siya na infected ang
kanyang
kabalo
siya infected ang patient.
Okay, no. And yun nga, pero kasi sorry. The problem is, 'di ba? Pwedeng negative pa karon.
Yeah.
When you're too early in your testing.
So, we have this window period na nakuha nimo ang virus but negative ka sa testing. So it's around 3 to 6 months atong window period. That's why we need to repeat the test. For example, nagpa-test ka kay na-expose ka ani after 3 months. Kung negative, after 3 months, retest. Kung negative, after the 6th month,
Okay.
test. Okay, para to make sure nga negative gid ka all throughout the 6 months na window period.
And behave muna habang nakikita
Yeah,
ka.
behave. No new exposure. No new
Kundi wala na
exposure.
yung undang yung ano.
Yeah,
pagbilang
muna
mo.
ang problem with the testing di ay tuod
Oo.
kay again mag-group fun. No, and then they said, "Doc, nag-testing me prior."
Oo.
But again, dili pwede ka nga dili mag-positive for 6 months eh.
Oo.
And dala na nimo ang virus. Actually, you're very infectious for that window period. Taas ka imong viral load ana nga window period.
Na negative pa sa test.
Negative pa ka sa test. So, muning nakahadlock yun ani HIV. Lisod kay siya i-detect because na ay problem with the timing.
Oo.
Also, there's a problem with testing mismo kay dili sila magpa-test.
Okay. Symptoms. Do they need to get tested when they get some symptoms? Naabay
Yes.
symptoms na ana?
So, we have what we call the acute retroviral
Oo.
syndrome or ARS. Kani siya nga syndrome murag tipdas. Okay? Fever, dayon sakit imong lawas, sakit imong kasukasuhan, ubo-ubo. Then what's notable is the presence of rash nga parehag naong sa tipdas. Dili mangkipak sa another topic na taas. So more siya tipdas and dagko kay ilang mga lusay.
Okay.
So that's around 2 weeks to 4 weeks from acquiring the infection,
Okay.
ang ARS. After ana, wala na siya symptoms for the next 8 to 10 years.
Okay.
Unless na siya makuha nga opportunistic infection. So, munang lisod gyud kaayo kay the time na we test them,
Nag-negative.
for the 8th year pa, the time we test them, nakaset in na ang kagaw, daghan na siya gibuhat sa imong lawas, no? So, mag-apas na lang dayon ta. That's why muna yun amo ang motto. Test early, detect early, and treat early. Yun ang mga.
Daghan ko nakita sa Facebook itong mga pride events, no? They actually gave out they did testing, mass testing sa mga nag-attend sa mga pride events, and that's a good thing also, no? I think that's also one way of of communicating it to them. You recognize their presence, like we celebrate these pride months, no? We celebrate, kumbaga, let's celebrate them, no? And let's appreciate them. And yan ang naging effect din.
Yeah.
Nagkaroon ng mga testing sites na very accessible, no? To those na attendees, for example, of these events, no? Kaya yun. Ikaw, Dwight, do you have any final message sa atong mga listeners? At saka mga fans mo, I'm sure, daghan kang new fans mo.
Okay.
Daghan man kay org. At saka mga founder.
Grabe, wala na nun ko. Pero, sige, I'll have to do a shoutout muna. So, shoutout muna for Lasal Guidance for making this possible, for allowing me. Sir Just, thank you so much for this opportunity. Also, I'd like to shout out to my organization, Iligan Youth Mental Health Association, and also at the same time, thank you to all those my friends who supported me throughout this interview, kasi very shy ko, dali ra ko maulaw when it comes to mga interview, and this is the first time that I get radio broadcasted. And I think my final words, especially to the parents, na always take care of your kids, give them the proper social emotional support, love them because they're young, and as much as possible to avoid finding their worth and influences from other people. They should really start from you, the family, and show them that they really are irreplaceable, because again, lives are irreplaceable, okay? They should not find their worth from the wrong places. It should always start within your household, your family. It's also encouraged na siguro if you can start a Bible study, why not? You can start a Bible study with your family, and also educate yourself with regards to the sex education siguro, perhaps, and what happens. Okay, so I think that's that from me po.
Okay. So, Thanks again, Doc Kitos and Sir Dwight. Nasa uulitin. And death from HIV/AIDS is starting to become unnecessary, no? Because treatment has been improved and is improving, no? Ang kailangan na lang ang tao na open enough to get themselves tested, no? And of course, testing yourself, getting yourself treatment is a favor that you give not only to yourself, tungod sa mabuhi ka. Like any other senior citizen, maabtan nimo ana na age with treatment. But it's also a favor you give to the community. So once again, thank you sa tanan na naminaw karon, and this episode will be present in Facebook, in Friends Radio's Facebook page, and also sa YouTube, no? Available din sa YouTube. Kaya balik-balikan, no? Mga dili naka real time na nakapaminaw karon. So once again, Iligan Medical Society is always here for going to give, no, as part of our community outreach, health education na makatabang sa atong community. So watch out again next Tuesday for another health topic for all of you. So goodbye and see you again next week.